Hey everybody, Massachusetts Governor Charlie Baker here, and I want to start by welcoming you to this virtual conference. Obviously, we were hoping that you'd be here in Boston to take advantage of all the great sites and the great restaurants and the great things to do we have here in the Commonwealth. But COVID had other plans. So as a result of that, we're doing this virtual, but I'm told we'll get you back in 2023. I go way back with this organization. I used to serve in the administrations of Governors Bill Weld and Paul Cellucci back in the 90s. I was Health and Human Service Secretary and Administration Finance Secretary. And I actually attended some of the National Academy's events back then, and maybe once in a while even had a chance to speak. I leave that these days to people like David Seltz and Luis Gutierrez and Dan Tsai, three terrific players here in the Commonwealth of Massachusetts who represent, I think, the very best of what we bring to the table with respect to healthcare and especially state health policy follow-through and execution. And I just want to say to all of you, this has been a particularly trying time for everybody in state government and everybody in the healthcare space. COVID is like nothing I think any of us have dealt with before, and we were all forced to make a lot of decisions in a very short period of time based on imperfect information and in many cases a scarcity with respect to resources and data and all the rest. And I'm incredibly proud of how many of us over those periods of months managed to find a way to get things done on behalf of the people that we serve and tried to do it in the way that made the most sense for everybody. I think, if anything, COVID has exposed all kinds of opportunities to improve our healthcare system. Certainly the arrival of telehealth here in Massachusetts for all kinds of preventive healthcare and behavioral health services has been a godsend. Some of the rules changes we made with respect to addiction treatment are things that I think should continue as we go forward. And it's obviously laid out for all of us a roadmap with respect to the things we need to do to dramatically improve health disparities and to deal with many of the social determinants of health, especially related to race and geography that came about as a result of the presence of COVID and what it sort of uncovered. The final thing I'll say is how much we appreciate these opportunities to gather. I can just tell you that from my own experience as somebody who's been in the healthcare world and in government and in the private sector for the better part of the past 25 years, gatherings are a great opportunity to learn. They're a great opportunity to hear from other people about a different way of solving a problem or thinking about an issue. And I certainly hope in this virtual world you'll all have a chance to do that. And obviously we all hope and look forward to the fact that at some point we'll be able to do this the old-fashioned way, which would be same place, face-to-face, and maybe even with a handshake or a high five. Thanks very much. Enjoy the conference.